Good evening, everyone, and thank you all for joining us tonight for the Latino Surgical Society inside the operating room. We'll let people join us, but we'll get started. My name is George Molina, and I'm a pancreatic and hepatobiliary surgical oncologist at Brigham and Women's Hospital in Boston, Massachusetts. On behalf of the founders of the Latino Surgical Society, I extend a warm welcome to everyone joining us tonight. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event is in line with this mission. I want to thank you all, our members, for supporting and believing in the Latino Surgical Society. Before we get started, I'd like to thank the team that makes these sessions possible, and also highlight the founders that have really worked hard in creating and sustaining and building the society. I would also like to thank the team behind the screen that have made these sessions possible. Aldo Trevino, who's a Latino Surgical Society web intern, Cristian Puerta, who is the social media intern, and our co-directors who have worked tirelessly to get the speakers and really get everything organized. The co-directors of the Inside of the Operating Room series, Dr. Oscar Salirosa and Dr. Alexandra Hernandez. Next slide, please. This is our mission. Next slide, please. This is a previous meeting that the society had. Next slide, please. And I would like to now also thank the institutional members that have made a commitment at the institutional level to our society. And here we can see our platinum members, our gold members, our silver, bronze, and our members at large. Tonight, I have the pleasure of welcoming Dr. Julio Garcia Aguilar for the latest installment of our series. Since 2012, Dr. Julio Garcia Aguilar has served as the chief of the colorectal surgery service at the Memorial Sloan Kettering Cancer Center in New York City. He leads a team of 8 surgeons and directs the team's clinical and research programs. He's the co-director of the colorectal disease management team and the director of the Colorectal Cancer Research Center at Memorial Sloan Kettering. From 2008 to 2012, he was the chair of the Department of Surgery at the City of Hope National Medical Center. Prior to that, he served on many faculties, including the University of Minnesota, the University of California, San Francisco, and was the surgeon-in-chief of the UCSF Helen Diller Family Comprehensive Cancer Center. He has co-authored more than 300 manuscripts and book chapters. He has served on the editorial boards of the Journals of Annals of Surgical Oncology and also Diseases of the Colon and the Rectum. He was the president of the Research Foundation of the American Society of Colon and Rectal Surgeons. Dr. Garcia Aguilar, thank you very much for joining us today. It's an honor. I would also thank you. I would also like to welcome our guest session moderator, Dr. Jonathan Pastrana. Dr. Pastrana del Valle obtained his bachelor's degree in natural sciences from the University of Puerto Rico. He then earned a doctorate of medicine in 2015 from the Ponce School of Medicine and Health Sciences in Ponce, Puerto Rico. Dr. Pastrana del Valle completed his general surgery residency at Beth Israel Deaconess Medical Center in Boston, Massachusetts, completing his chief year in 2023. Throughout his residency, he immersed himself in surgical oncology research, where he served as a research fellow at the VA Boston Healthcare System, Dana-Farber Cancer Center, and the Brigham and Women's Hospital, where his research focused on colon cancer immunology and clinical outcomes, with a special emphasis on addressing healthcare disparities. Currently, Dr. Pastrana del Valle is pursuing advanced specialization in colon and rectum surgery through a fellowship at the University of South Florida. Welcome, Dr. Jonathan Pastrana. Thank you for being our guest moderator, and I'll let you take over the session.
Thank you, Dr. Molina. So thank you, Dr. Garcia Aguilar, for the opportunity for letting me do this session and also interview you. It's an honor. We're going to start more or less with a casual question. We would like to start with where are you from and why did you choose a career in medicine?
Well, before anything else, just let me thank you guys for inviting me to participate in this forum, which is very important to me. I mean, I feel Latino, and it's great to be identified with so many friends. And then with Dr. Pastrana, I don't know if you probably know that I also did my residency at Beth Israel Hospital before they merged with the Deaconess. So I think we have an alma mater in common. So, yeah, so I'm originally from Spain. I grew up in a small village in the middle of the country in the province of Toledo, and I went into medicine because I like science and I like biology, and at the time it was a career that it was a very good career for somebody who had the interest that I had during my school years in Spain. I always had also the role models of the doctor in the village. We had a personality that attracted people, and somebody who was really a role model for many of the kids. So I think the combination of the fact that I was leaning towards science and biology, and then the fact that the doctor, he was a general practitioner, but quite attractive personality. I had very good relationship with him. They were probably the deciding factors that made me go into medicine. There was no one in my family who had been in medicine before. So that was very much it.
Oh, that's a very interesting point of view for looking from a stranger, basically looking at a doctor from your small village. So more or less, you kind of touched base a little bit into it, but was there any point during your educational journey, or in particular, can you tell us about a tipping point in your career that propelled you forward in the direction that you may not have expected that you were going to end up or expected at the time?
Well, I think there are always many different, for I say the tipping points in the different aspects of your career. Why do you go to medical school? How do you take this path in medical school? Why do you do this? You choose surgery? Why do you choose colorectal? But there is one that really, looking back retrospectively, the one that impacted me more than any other moments in my career. I went to medical school without really having a very clear idea of what was, the medical school. You start, in our medical system, we had the 6-year system, and the first 3 years, they're essentially basic science, anatomy, physiology, all these disciplines that they're essential for medicine, but you didn't have contact with patients. So when the day came that I had to start internal medicine, all the clinical rotations in the second half of the career, students those days, they used to become what we call interns in one of the departments. And, people already at that time used to show their preferences, and they would become kind of interns in medicine or interns in surgery or interns in, gynecology. And my interest was in medicine. I just happened to, after the summer period of that particular year, I was going to school, and I met one of the friends from the same area where I was from, who was a couple of years ahead of me, and I asked him, so what should I do? He said, well, go to talk to this doctor who, is a very nice guy. He's a very good mentor. He's a best educator. And his name happened to be also Julio Garcia Paredes. So I went there, knocked at the door, and I say, Dr. Garcia Paredes, I'm so-and-so, and I'm interested in being an intern in your service because I have, very good references. That person was a tremendous mentor to me. He was a gastroenterologist. He was a person who has been trained abroad. He had a very broad perspective of medicine, a broad perspective in the world, opened my mind, created the sense that I have to just study, beyond medicine, travel, see the world. And I think to some degree he's responsible of my academic trajectory and me coming to the United States eventually and be who I am today. So that was one of the critical moments. There have been others, like me ending at Beth Israel Hospital, which was also kind of serendipity, and meeting the chairman then, Dr. Silan, and all these legendary people, and all the friends and colleagues that I had. But I think that probably one in medical school was the most impactful, because it was at the time where I didn't know what they were going to be, and that kind of put me in the path of being a clinician and academician for the rest of my life.
Perfect. Yeah, no, it's very interesting. I've only heard stories about a lot of the, at least for your circles, being in the same program eventually, like Dr. Silan. So can you tell me a little bit about some of those role models that you had while you were a surgical resident?
Yeah, definitely. I mean, I think you need role models. I mean, I had role models like Dr. Garcia Paredes, who unfortunately already passed away, so Dr. Silent. But then I had very good role models during surgical residency. I think Dr. Silent was a tremendous role model. He was very demanding, but his pursuit of excellence and his intellectual integrity, I think they were outstanding. So he was quite demanding, and you probably have heard some of the legendary things that he used to make us do. But I think that was that was something that really resonated with all of us, all the people who trained with him. Being very demanding, pursuing excellence, and then honesty and kind of intellectual integrity. Always, looking at things from a very honest perspective. I think. That's something that I really remember. I had other role models. I can tell you, I had then the fortune to train in Minnesota, the University of Minnesota, where I have a number of them. Dr. Goldberg, Dr. Rothenberger was a great mentor. Madoff, many, they have been people who have inspired me in many different aspects of my career, all, for a clinician, researcher, and also in academics, for example, in DCNR, working with Rob Madoff, they were great inspiration. You're going to find many of them in your career. I mean, there are a lot of people around. You just need to open your eyes and identify them.
Yeah. So now that we're looking at more or less, you're looking back at that part of your life. If you could give yourself, your younger self, some advice, what would that be?
Well, I think I put the work that I was supposed to put, and I had the curiosity. Probably I will tell myself to be a little bit more patient. At some point in my career, I might have been a little bit impatient. So I think that's something that when we are young, sometimes we don't realize that everything takes time. To gain experience just in practice, you have to see patients. You have to just go through that phase. The same thing happened with the research. You have to, do your homework and wait, because your moment is gonna come. Sometimes, at least I'm reflecting on myself, we wanted to get to places a little bit too fast, and I think probably that's something that I will have, told myself. Yeah, and also the other thing is appreciate the moment, live the present a little bit more. Appreciate everything that is going on in your surroundings. I think that would be probably the two things that I would like to, maybe reflect a little bit more, and it would have been good for me, maybe.
Yeah, I kind of getting into that. I've been reflecting on it because obviously being from the same place and everything, and you don't know this, but my first grand round was, you were the first grand rounds that I ever visited as an intern, first month of internship. So it's very interesting now, me seeing 8 years back how everything went so fast, and now I'm interviewing you when I literally saw you in the podium for the first time when my first grand round as an intern. So it's very interesting to just, and I also reflect on the sense of what would I say to that person, to me 8 years ago, when times just fly. And in that aspect, obviously all of us have gone through different challenges and throughout our journeys. What would be one of that you will say one of your greatest challenges or obstacles that you encounter while during your career, and especially on your career advancement?
I mean, it's hard to think about a significant obstacle. I've been so lucky. I have always people helping me. If there was any obstacle, it might have been me, my stubbornness, and things like that. Because I cannot think of anything that has been a significant obstacle that I saw in that way. I mean, I think, for example, like just talking to Latinos, English is not my first language. It was not even my second language. When I went through the schooling system in Spain, we used to take French as a second language. So I started to study medicine after I decided that I wanted to come to the United States. That might have been a little bit of a handicap, but I wouldn't call it an obstacle. There are always obstacles and there are always difficulties. You know how difficult it is coming from a foreign country, being a foreign medical graduate, to get into a residency program in a residency position. That is a difficult situation. You just have to have faith and work hard, and just seize the opportunities that they're going to be presented to you, and maybe just being a little bit smart to open that path for you. You might not be able to get this way, but you go around and then you do a year or 2 years of research, so you can overcome all these type of things. I wouldn't call them really that I have tremendous obstacles in my life. I think you have challenges, and you just have to respond to the challenges with work and determination. I mean, I think that's the way I view it. I didn't encounter any major, obstacle in my career.
Oh, that's very, very good to hear, especially for maybe some people in the audience, because I too, I started as a prelim and all that stuff. I had to go my way through around to just get here. So I wouldn't say it's a challenge. It was just a different path compared to the normal thing.
I think that in my case, I ended kind of repeating the residency and doing it twice. Well, but I think if you really want something really bad, and you work at it, I always tell people, you really want to do it, you will do it. You will find a way to do it. And I think we have some handicaps, but I think that's probably what make us special also, because we have to overcome all these extra hurdles that we have.
I always say the resilience of, I've seen so many other residents that have come through my path, and the resilience of them and working harder than the regular person. It's very, especially from international medical graduates, I see it all the time, especially in Bethesda when we did residency. So a little bit changing, obviously not the challenges, but now can you tell us a little bit, you have so many research accomplishments and so many accomplishments in your career. Can you tell us which one are you most proud of from all of your accomplishments?
I mean, it's very difficult to tell. I feel proud of things. I mean, all these accomplishments, they just happen with time. So you don't have the sense that these things just happen overnight. That is a good surprise. Probably, honestly, if I had to say something, it will be looking back retrospectively now when I'm at the end of my career almost. Looking back of the things that they have accomplished, what I realize is that they required something that I didn't know that they have, which it was persistence. So, I feel a little bit happy with the clinical trials that we have done. And, that has been possible thanks to many, many, many friends and collaborators, including my good friend, Jorge Marcet. And so if I'm a little bit proud of anything, is haven't been able to be persistent, because I didn't know that I have that. When I started, I didn't know if I were going to be able to get something that is a long-term project, 5, 6, 7 years clinical trial, and be able to start and finish and get it to completion. So in that respect, I mean, all these clinical trials that we have done over the last 20 years, I feel proud of them because it required something that it was just work and determination. I also enjoy very much the time I spent in the lab, in the well lab. When I was junior, I was in Boston. I spent time with Tim Springer's lab. That was a challenge because, I was not very proficient in just biology and molecular biology, and learning all those things was a little bit of a challenge, but I think it was also very gratifying. But I think, the clinical trials, for that characteristic that I mentioned, I feel proud also because they probably had an impact in the life of the patients and the quality of life. So
it's something that I now being here, obviously with a good friend of yours, George Marcet, I hear all the time and about the impact. He's also very passionate about it, which is good to see somebody that I work with every single day, the same passion with how to take care of patients, how to do the clinical trials, and being how important, and that cultivating that is I think a very important thing, and especially in the younger generations of surgeons. Changing a little bit of moving aside to now the new generation that's coming in, what advice would you give surgical residents or medical students looking for a mentor, like the ones that are coming up now?
Well, I mean, I think just talking about my own experience, I mean, you have to just find someone that you admire. you have to have admiration for someone for whatever the reason. You find them that they are a very good teacher, they're a good clinician. I will look for the characteristic that I mentioned to you before. I mean, a mentor has to be somebody who is going to be generous. I mean, who is going to have all those characteristics. He's going to be somebody that you admire intellectual and professionally, and you're going to be generous with the time, and you're going to be inspiring to go to other places, to move to the next level. And I work with wonderful colleagues. I have wonderful friends, and I think there are many people in our field that I'm sure that they can be great mentors. So I would look for those characteristics. Somebody who you really admire because of the, clinical expertise, because they are also able to, teach and they are generous with their time. But as I say, you're going to find many of them. I have known a lot of people in this society, and there are great mentors everywhere.
I think sometimes we have to just reach for them. It's not they don't come by themselves. You have to cultivate that relation.
Yeah, absolutely. I mean, this is one of the things that I tell sometimes to medical students. We are busy. I'm busy, and I tell when we're talking to people that they are now in their late 20s, in their 30s, it's not only about teaching; it's more about learning. So I ask them, ask me questions, because very often when you are in your clinical practice, we have busy schedule, much busier than our mentors used to have, because we have much more pressure, clinical pressure, and you don't have much time, and we don't know what you don't know. So I think part of the problem, you have to set your goals, and then you have to be there. You have to be there, and you have to be with that mentor, and you have to make that mentor look at you. And I mean, you don't want to be a pain. You don't want to be somebody who is always, open their mouth and all these things. But they have to show that you have to show them that you have an interest, and then people will reach out to you. And of course, when they call you, when they give you the opportunity, you have to be there. So I think you have to be proactive. You just cannot wait for somebody to take you under their wing. You have to just go and request it with your presence.
I always talk to Dr. Marsan and tell him I need learning from the gray hairs, from all of the experience, all of the things, especially in the OR and everything. If you can give some advice for residents that are interested in a career in colorectal surgery, what would be your advice right now?
Well, I mean, I think I chose colorectal surgery. I could have chosen. I like everything in surgery, and I ended just becoming interested because different reasons. And I don't regret it. I mean, it's a great specialty. It's a good feeling on itself because of the diversity you have. From the most complex to the simple procedures. You have challenging conditions. I mean, there is nothing more challenging than a fistula nano. You have a big cancer operations, and then you have hemorrhoids and fissures. You have conditions such as pelvic floor with the physiology, and you have everything, endoscopy. What I like the most about colorectal has been my partners, my colleagues. It's a great specialty. I mean, it's just the people are nice. I don't know why. I mean, we're colorectal surgeons. I guess that we cannot be too pompous about it. And it's a lot of, down-to-earth people. It's a great society, and I always enjoy going to the meeting and meeting friends for many years. So I think it's a good specialty because of all the things that I say. Interesting pathology, benign conditions, inflammatory bowel disease, diverticular disease, all sorts of pathology. I think it's a good field. And there is a lot of demand. I mean, colorectal cancer is the second cancer. IBD is a big deal. So I think it's a very good field where you can affect the lives of many patients.
That's exactly. Every time that I have a med student, they ask me, why did I go? And it's just the field is so big but narrow at the same time. You can do anything from open robotic to anal rectal disease to cancer to benign. So I'm 100% with you, and I think that's one of the things that passionate me about colorectal is just the impact that we can have in patients, especially cancer patients, which is, I think, growing, and it just keeps evolving. And I think it's I think it's the best field to be in, but I'm just a little bit biased. Can you tell us a little bit about how do you build a research program leading a high impact research? How does that come about?
Well, I think, the research has to come from questions that you are yourself. There are many things that we don't know, okay? And so if you are somebody who has some curiosity, you're going to say, well, we are doing this thing, but why? Or can I do this thing differently? So you have to ask yourself a meaningful question. And you have to learn how can you answer that question. So of course you have to have mentors, and you have to be in an environment with people who have show you kind of a little bit of the methodology, whatever you're going to be doing. So you have to learn the methodology of translational research, if you're going to do clinical research, what is a clinical trial, and then ask yourself some meaningful questions that they have a reasonable answer. So a question that is answerable. I mean, there are so many questions that we have that, it's very difficult to organize that question in a clinical trial, so to speak, or in a clinical situation. So I think that's how you will organize your academic career. You have to be in the right environment with the right mentors, and then your profession is going to bring you the questions. Okay, and then you have to say, okay, well, this is something that we don't know. Can we add some knowledge to this? And what would be the way to add the knowledge? I mean, there are not that many questions in surgery that you can ask in a prospective randomized trial, but there are other maybe smaller phase 2 trials, or there are even reviews on literature or reviews of experience. You have to start with meaningful questions, and then just learn what is the methodology that you need to apply to answer the questions. Of course, the methodology you have to learn, working with other people, in other people who is doing research, and that they're going to teach you, whether it's, how to conduct a clinical trial, or how to, do a, meta-analysis, or just how to work in the lab. So I think that's my advice. Be curious and ask questions, and then have the persistence to carry them, to a resolution, to an answer. Okay, those are the things that you need to do research. That's what we have done over our career. And don't be afraid to, just take enterprises. The first clinical trial that we did, say, well, is it going to work? It's not going to work. You ask money from the NIH, and the question is good, and you persist, and you listen to the critiques and the advice and the comment that you get from other people, you will get something done.
Yeah, I think especially in research, and from my I did a lot of basic science research. It's the failing and continue of moving forward that pushes you, because you're never going to be like successful with every single experiment, with every single thing that you do. Even whatever idea you have might fail, but that doesn't mean that the major idea failed. It's just that particular moment, I think, is the persistent, as you have mentioned multiple times, is the important thing, is the resilience and moving forward.
Yeah, and sometimes, you're going to find something that is unexpected. I mean, I have started some project with the idea that we're going to get there, and this is what was going to happen, and we didn't get there. We found something different. I always give the example. When I started in the lab, I was looking for a, factor in the serum of trauma patient that they were going to, cause the immunosuppression that we thought that the trauma patients had. And I ended just finding that, the serum affected the cells in normal individuals, and then we just continue looking at that and got a completely different line of research. So you always have to have curiosity and an open mind, and as you say, persistence.
Yeah. Well, we all know about your accomplishments and obviously your trajectory, but can you tell us a little bit about your life outside of the operating room? What is being in the life of Dr. Julio Garcia Aguilar outside of the operating room?
No, a little bit, not much. I'm dedicated to family. I'm married, I have a wife and 2 kids that they're already independent and living on their own. I dedicate time to my family. As everyone say, I should have dedicated them more time. So that has been the biggest part of my free time. Other than that, I like to read. When I was younger, I liked movies a lot. I don't go as much as I used to. Like a little bit music. And I see the hobby that I have that takes a little bit more of my time is cycling. I ride a bicycle whenever I can. I play sports all my life, but at old age, running, it gets more difficult. When I was in Boston, I used to run a lot along the Charlotte River. Now I just ride the bicycle and try to be fit. I think it's important. To be a surgeon, surgery is a physical sport, and you have to be in shape to be able to do it at a good level in older age. So you have to take care of yourself. So I advise that. Those are my kind of type of things. family and sports and a little bit of looking at other areas. I think reading outside medicine is also very important. Open your horizons.
I had that question specifically about cycling because Dr. Marcel asked me, like, how are you cycling now in New York compared, he knew from California. It's like,
yeah, well, I thought that my cycling career was over when I moved from California to New York, but I was mistaken. I mean, there is a lot of cycling in New York. New Yorkers are a special breed. In Central Park, people ride in the morning at 5:30 in the morning, from 5:30 to 6:30. I ride some days. Some of my friends ride year round, even when the temperature goes below freezing. I don't go out when it's below freezing, but still on weekends, even in the winter, we ride. We ride across the George Washington Bridge and we go north. So, it's a very big cycling culture in New York City.
Yeah, most people don't understand how New York is. Obviously, my wife, she lived in New York for 7 years, so she kind of explained it to me. I'm like, it's a different breed, it's a different place, but it's a great place, I think, for certain people, not everybody, but I think certain people love it as a place. Another question that we have, what brings you the most joy and fulfillment in your career? What has been like the thing that brings you the most joy specifically?
I think all these academic things, they bring you joy, but I think it's still patient care. I think occasionally, the good thing about surgery, one of the good things about surgery is that you cannot get immediate reward. You do an operation and the operation goes well, and it's something that relatively soon. Shortly, that's a short period of time. You cannot just pound yourself in the chest after you just finish in the operating room because, we are humbled very often by complications. But, when the patient come back a month later, you have done an operation and everything has gone well, it just gives you a lot of satisfaction. I think the most satisfactions have been from surgery, doing one patient at a time. Particularly when you find somebody who was a difficult case, a difficult situation, you operated them, and then 7 years later, you get a letter telling you that somebody who you didn't believe he was going to make it is still doing well and is happy and has gone on with his life or her life, and they have moved on and they have children or things like that. I think that's probably is hugely rewarding. I think that's probably where you get most of your rewards, and the patients are very, very grateful. Also education is when you see people that you have trained, that they have done well, that they have advanced in their career, is also very rewarding. But I think probably number one for us, it would be just patient care. Yeah. We get most of our rewards.
Yeah. For me, it's been interesting now, first taking care of patients and seeing them afterwards, because we don't get to do that in residency because you switch so much. And now being in this year, seeing patients that I operated in August starting, and now seeing very difficult case doing great out of the hospital, I think it's been very gratifying. And also seeing patients that my attendings have taken care of for 20 years and they come back, and I had a patient that is the husband of a daughter of a patient. Like, they continue to come because of the great care and they love each other. And I think has been very satisfying and joyful to see from other people. So I think in the career, it's something that I've now learned to appreciate more, because you don't do that in residency so fast, and you're just moving around, and then you change and people forget about their patients. But I think fellowship has given me that perspective that I didn't have before, which has been very gratifying.
That would be the main source of gratification from the profession, in my opinion. That would be the biggest one.
Yeah. So we have a couple of other questions that I think the audience have been sending us over here. I'm going to start with one of our first question from Felix Carofilis. His question is, I'm interested in general surgery, but right now I fall in love with robotic surgery. Is colorectal surgery a great opportunity to get into robotic surgery? What's your experience with it?
It is. We have been early adopters of robotics, and essentially all the cases all the colectomies and low anterior resection that we are doing them robotically. So yes, it's a good field. Some other people might feel differently, but for us, robotic is a big field. We do everything. today, I did an LAR, combined with another GYN procedure this morning. Then we did a hysterectomy this afternoon. I do 2 or 3 cases a day, and most of them, they are robotic. We still do a lot of non-robotic cases. We still do a lot of recurrences and cases that require to be then open. But yes, I mean, colorectal is one of the big robotic fields today and in the future.
Yeah, I just came from doing a sugar baker robotically, and we don't do LARs robotically. I know that I've experienced it. I don't want to do that laparoscopically ever again.
Yeah. It's a good field. I mean, robotic is controversial still. I mean, some people feel that it hasn't been proven to be superior, but because I mean, the trials that they have done, they show just a little bit of an improvement in the conversion rates and things like that. But when you see the operation done robotically, done operably, there is a significant difference. We do it, all the cases. So yes, the answer is, if you want to be a robotic surgeon, colorectal is a great field.
Yeah. Dr. Molina?
Hi, thank you. This has been fantastic. I actually have 2 questions. One related to the robotic discussion. As a surgeon, what is your sense of how doing robotic surgery affects you as the surgeon compared to doing it open or laparoscopic? Because all these studies have been looking at outcomes and survival, and none of them have been superior. A lot of them, at least in pancreatic surgery now, are showing that they're the same.
Yes.
Not inferior. But there's a big difference on us as surgeons. So I'm just curious to hear from you.
That's an excellent question. Yes. I mean, I think particularly when you start to get older like me, I mean, I consider myself in very good shape, but one of my knees, I used to play soccer and I had injuries and I had some arthritis. That's the reason why I gave up running. If I do one of those big cases, a big pelvic recurrent that I have to do a big exenteration and I'm going to be all day in the operating room, my knee hurts. When I'm sitting in the console, it doesn't. Laparoscopic was also very taxing when, you have to have your arms all the way up. When I'm sitting in the robot, I rest in my arms. Definitely, the ergonomics are completely different. I think it could prolong my life for years, doing robotics. I don't feel the same pressure that I used to feel when I was doing laparoscopy. It was much more demanding. The position to working in the pelvis, the instrument, the weight is different. I think that's something that is not measurable, and another reason why I do it. But I think it's a benefit that we cannot ignore.
And as an early career surgeon, I'm in the process of building my clinical practice, building my research practice, and also being there for my family. And we have a lot of members who are also in the same phase, first few years of being in practice. Just curious what advice you have to early career surgeons who are trying to do it all, it seems, and looking to people like you who've really done it all. I would say, what advice would you give to us?
Well, I mean, I think as I say, I would need to ask my sons. I mean, I got 2 sons that they are now 30 or 31. They don't seem to have a bad relationship with me, so but I think I could have probably spent a little bit more time with them. But I still was able to make it home every night and and spend time with them. You have to try to be efficient, and also, as I say, you have to have patience. You cannot do everything at the same time. Building that academic career is going to take time. Building a clinical practice, it takes time. My former mentor and friend, Dr. Goldberg, used to say that it takes a minimum of 5, 6, 7 years to build a clinical practice. So you start young, and there are more senior people, and you're going to take some time. You have to be there. You have to be able to do the cases. And then, for example, when I was younger and my kids were small, I used to come home to see them at dinner, and then have them go to bed. Then I used to work, and at home in the computer. If I were writing, if I had put in some ideas, editing some papers, I was able to do that at home. I cannot do that now. Now when I go home, I usually don't. But in those days, you are younger, you have a little bit more energy. Sneak out wherever you can on the weekend, and just try not to steal too much time from the family, but just put a few hours doing this, doing that. That was the way we did it. Try to strike a balance. But I think when you are younger, I mean, the advantage is that, you know, you have much more energy. You are able to do things that I cannot do right now. You know, because you get tired. So, you know, I think you have to prioritize and again, do all these things and be a little bit patient, because it will happen. If you keep on doing what you are doing year after year, before you realize, you will have something built academically, and you will have a practice before the blink of an eye. I think it's just dedication and try to, you know, manage your time the best you can.
Thank you.
Yeah.
And on that topic, like how can well, sorry, there's other questions, but how can other surgeons help our Latino surgery colleagues more? How is it something that you think that other surgeons can help the Latino community and the Latino surgery community?
How can we help the Latino community, or what can help them?
Basically, how can other surgeons help our Latino community colleagues? Like how we can improve that and make it bigger. I think the question comes from the point of like the Latino community, especially the surgeons, is small. How can we continue to grow that?
Well, I mean, I think you know what you are doing. I mean, I think these forums are a good way to just, you know, call, you know, people to know that this society exists. I mean, the Latino community we have in this country, we have an advantage, is that there is a big Latino population. And, you know, I think there are many patients that they're going to feel more comfortable speaking to you in your own language and understanding what you are. So we have, yeah, you know, we have some handicap, but we have also some advantages, because there are a lot of patients that they are primarily Spanish speaking or Latinos, and, you know, and they're going to be comfortable with us. I think in terms of, you know, promoting ourselves, I mean, this type of societies, you know, my colleague, Dr. Jose Guillen, who was a member of, you know, our department, you know, had his own local group of surgeons that we used to get together and just social interaction, you know, communicate with each other. So I think that's probably the best way that we can do. Of course, you know, that can expand into mentorship. You're going to have, you know, Dr. Marcet is a leader in our field and he's a mentor, and I think he's probably going to be more sensitive to a Latino potential trainee. You know, I have helped over the years fellows that they were Latinos, and they reach out me, and, you know, I have a number of trainees that they have been Latinos working with me. Patricio Lin, just finished, is now a surgeon in Pennsylvania. People who went back to Spain. You know, over the years, many Latino people that we have trained. So I think we have to just network. I mean, the word is networking, and networking, you know, with everyone, the junior people that they are starting, and the more senior, established, you know, surgeons or members of the you know, profession, that they can help them. So I think it's just networking. I mean, just the fact that, you know, we are talking here, you know, is positive, because we're going to know each other, we're going to be able to interact, and you know, just have a professional relationship. So networking is the answer. Okay.
Networking, especially so interestingly enough, we have both of me and my co-fellow, we're both Puerto Rican, so we have 100% Latino this year, and I know for a fact, you know, one of our next fellow is also a mentor of yours.
Yeah, but he's not Latino, but he's a phenomenal guy.
He's a phenomenal. We're looking forward to having him, but not Latino,
yeah.
but also minority, which is also important.
Yes. I always tell that the Koreans are the Latinos of the Far East. They have very similar character to the Latinos. I get along with them very well. Jin Kim is a Korean guy. He's a phenomenal surgeon and scientist.
No, yeah, we're very lucky to have him. We have some other questions here. Sammy Castillo asked me, one of our members, what are some of the questions you are currently focused on answering in the field of colorectal surgery?
I mean, I think we still, you know, have many questions. I mean, I think my area of research has focused, as you know, lately in colorectal cancer, particularly in rectal cancer, and I think we have now kind of shown that many of the patients don't need surgery. The question that we still have is, what makes some of the tumor response and some of them why not? What are the mechanisms behind that? We are working maybe designing another clinical trial in some subset of patients of the MSS that they have some special immune profile. We can take advantage of that. So that's a very specific question. But the bigger question is still about the biology of colorectal cancer. Why some tumor response and some of them don't, and why some tumor metastasize and some of them don't. I think that's at the translational level question that we can ask in ourselves. But that's my particular area of interest. But I think there are many. I mean, you just look around and and there are many different questions. Still, the scope of the surgery when you have given neoadjuvant therapy and the tumor has shrunk a lot. I mean, we still have that question. We are still debating the question: do we need to always take the rectum? Can we do a smaller operation? Can we do local excision? So there are still a number of questions. Some of them they are purely surgical, like that one. So I think there are still a number of questions that I keep on asking myself, about specific areas, both in the lab and then just the clinical applications of that.
No, yeah, it's very interesting, especially like the transition that rectal cancer has been having lately with like watch and wait and like different who gets into that scenario, who can you put in or not, and it's very interesting. So another questions, this is more of a trainee question. What skills do you look for in residency working with you in the OR?
Well, I think, I mean, in the OR, I want people who pay attention. Yes, I think that's the most important thing. There are some basic skills that you can get outside of the operating room. Okay. In the old days, we wanted to just learn how to give stitches in the operating room, how to use the instruments in the operating room. There are many things that you can do outside. So, so we want people who come to the operating room having as much of the basic skills as possible. Even in robotics today and in laparoscopy, you have simulators that you can advance a lot of that. So you want people who, they already are working in those basic skills, and that when you see them in the operating room, they pay attention. And you can tell them, okay, do these movements, so they are able to just try to replicate that. People think that in the operating room is just letting you do something, and when you have experience, you realize that it's not just letting you do something. It's gonna teach you a number of gestures that make you the surgeon that you are. I mean, particularly that's pretty interesting with the robotic. You had to tell people, you had to do this with your left hand, you had to do this with your right hand. This has to be the right movement. So you teach a number of gestures. So you want somebody who is going to go beyond the what I'm doing or I'm not doing it, but I'm listening to what you are telling me, and I'm trying to replicate what you are telling me because you are trying to teach me something that is important. So when you see a surgeon that goes smoothly through one operation, you have to try to understand what the person is doing and why the operation is flowing the way it's flowing. What are the different steps that person is making? What gestures are happening? You do this with your hand, that with the other one, and and so on and so forth. So you want somebody who is going to be paying attention, and when you tell them, "I'm giving you the instruments, do this," they're going to, try to do exactly what you told them that you wanted them to do. There is a method about surgery. And there is a method about how to replicate that and how to acquire those skills.
I think it comes with time and everything, and the teachers and being patient. Again, it's kind of like the theme. It's like you need to be patient with all that stuff.
Yeah.
Well, we want to thank you for taking a lot of. We know you have a very busy schedule. You're a very busy person. We really appreciate that you have taken your time to have a chat with me and with all of the members here. But before we go, we have a section that is basically quick, rapid fire questions that we want to just ask. We usually ask our the people that do the interview with us. So if I can keep you for 5 more minutes, I will start with this. What is your favorite city?
Well, I like New York. I like a lot San Francisco. San Francisco, it was a place that I felt special. I love San Francisco, also because of the nature around it. Yeah, San Francisco is a great place.
What is your favorite surgery to perform and why?
All of them. The last one I did is a right colectomy, and a right colectomy with CME, a central vascular ligation, is a knee operation. It's very well suited for the robot. So I would say the last one I did was the one I like the most. But yeah.
What is your all-time most memorable meal?
Wow. You know, I'm not a big foodie. I like food, but I'm not one of those crazy guys that like foodies. The meals have been memorable for me because of the people that they were around. Just from the fun point of view, I had several meals with friends at meetings like the American College of Surgeons and the American Society of Colorectal Surgeons. I can name some of them. I remember one in New Orleans with some of my colorectal friends, one in San Francisco also during the American College of Surgeons, that they were memorable. Again, the food, but more than the food, the company. I think that will probably make those occasions memorable. And many of them have been with my professional colleagues and friends.
So what is the best advice you've ever received or you've received?
I mean, I have received so many. I don't know. I think, you know, I mean, I have received a lot of advice. I don't know one that stands out right now. I think once one of my friends once told me about a job that I was attracted to, that I was applying. I didn't end up going there. And, you know, it was like a good job with a good salary. And my friend told me, be careful, because you might like the job. You cannot get a job that you can like only every 2 weeks, essentially, when you get a paycheck. That was a good advice, to not take a job just because of the salary. That stands out as a good advice. You know, call my attention and say, be careful. You know, don't get just distracted by the goal and go there. And he put it in a very nice way, and it was an eye-opening.
Yeah,
I remember that. It was something not to take something, so to speak.
Yeah. What are 3 things you can't live without?
I mean, you know, of course I have, you know, my family. I mean, my wife, you know, we are very good friends. You know, I would be very sad without her. I wouldn't be who I am today. I mean, I think I would say my profession and, you know, but I think that has to stop. So I should be able to live with that. I think with my faith or my principles, I think it will be difficult for me to, you know, just not be what I consider my principles and my core, and, you know, my dedication to my people. I couldn't live without that. So I think those are probably the main things. Everything else you can live without it. I mean, you know, you can live without many things, but your family, your core, your ideas, your principles, you know, I wouldn't be able to live without them. I wouldn't be able to look at myself if I didn't have that.
What profession other than being a surgeon would you like to attempt?
I mean, I think it's very difficult. There are many things that I like. Things that they are a little bit creative. Architecture probably would have been something good for me, other than medicine. But I guess I could have been even a lawyer. I don't know. I mean, I think it's just a matter of. I'm of the opinion that the vocations. I mean, you are not born with a vocation; you develop them. Las vocaciones no nacen, se hacen. So, you know, you might have I told my kids when they were looking at the profession, look at your skill sets, okay, at what you have in your toolbox as your skills, and then just pick up something where you can apply your skills. And within that area, whatever you decide, just put all your blood and all your energy behind that. Just be passionate about it, and just put all the dedication, and the profession will pay you back. So that's my advice. You know, I could have been many different things, and I don't know if I would have been as successful, but that's the way I view it. I mean, you have to, if you cannot tie your your shoelaces, it's unlikely that you're going to be a good surgeon. But if you have a basic skills and you have a normal, mental capacity, and you just decide to do something, just put all your energy and your passion and your dedication, and you will be successful.
Perfect. Yeah.
That is my view of how this thing works.
So we have 3 last questions. How do you start your day?
Well, I usually get up, have some, juice, and I usually exercise. I usually, before going to work, I either, exercise, general exercise with a trainer, or I do a stationary bike. But I think probably 4 out of the 5 days of the week, and then on the weekend I do it. So probably 5 out of the 7 days or 6 out of the 7 days of the week, I exercise before going to work.
What is the best gift you have ever received?
Oh, many. The best gift is education. The gift that I received from my mentor, in Spain, Julio Garcia Paredes, or from Dr. Silan, or for many people. I mean, all my senior residents, my colleagues. I mean, that has been the biggest gift. Nothing comes close to that.
Perfect. And lastly, what is your favorite sound?
I don't know. My favorite sound is probably the smile of a kid.
That's a great.
Probably is my favorite sound.
That's a great way to end it, with a smile.
Yeah. Okay.
Well, Dr. Molina.
Yes. Thank you. Thank you both. This was excellent. I've learned so much. I've been inspired. I'm walking away with a lot of jewels here. So thank you to you both. We'd also like to thank all of our attendees for taking this time to spend with us and to learn more with Dr. Julio Garcia Aguilar and Dr. Pastrana. If you're interested in learning more about our organization or becoming a member, you can find us at LatinoSurgicalSociety.org. You can also find us on various social media channels with the handle @LatinoSurgery. And the recording for this session and all of our previous Inside the Operating Room sessions are posted on the YouTube channel. Thank you very much. Buenas noches a todos. Until next time.
Thank you. Thank you so much for having me. Pleasure.
Thank you, Dr. Garcia Aguilar. It's a pleasure.
Yep.